Hello, all. We are very excited to have you with us today. As you trickle in, if you could answer our brief poll about how much you know about the Shatterproof Atlas tool, as well as if you could add in the chat your name and your organization and where you're located. We would just love to get a sense of who is in the virtual room with us today. It looks like we got some good Pennsylvania representation so far. Oh, New Jersey, I'm seeing Integrity House. So very excited. Yes, Lake Harbor. Oh, Florida. Oh, New Directions. Love it. Love it. So we'll do one more minute and then we will dive in and get started. And truly thank you for putting your name, organization, and location in the chat. It is great to see that we have people from all different states. Myrtle Beach, South Carolina. Love it. And given that we're just about time, Amelia, would you share the poll results just so we can see how much people know about Atlas to start this off?
Absolutely. Thank you all so much for participating in the poll. It looks like the majority of people here have never heard of Atlas, and this is their first introduction to us today.
I love that. I love it. Man, I think we can. There we go. So we can share the results and see that 60% of people know nothing at all. 36% are familiar with the name. Just a touch know a lot. Well, that is great. We are here today to tell you more about Atlas and really help you understand what exactly this is. And so obviously we're at our August provider roundtable. We are very excited to have you all here. And as you likely saw from the chat, we have different people from all over. This roundtable in particular is directed for providers in New Jersey, Pennsylvania, and Florida, as well as any stakeholders in those states who want to join. So you are seeing people from several different places along the Eastern Seaboard. And so with that, I would love to take a moment, if you could just put in the chat, and thank you all truly for participating so much so far. If you could just put in the chat what you're hoping to get out of today's roundtable. You know, would you want to know about, are you thinking, I want to know about the history, I want to know what our facility has to do, I want to know how you all determine the quality measures. Would really just love to get a sense. Not a skill kill, I love that. Any information, love it. Information in general, how it can benefit, how to get listed, how it will impact us, more about the program and networking, perfect. Resources, implementation direction, provide services to more people in need. How does it benefit a program? Oh, I love these. When will it be rolled out? These are all fantastic questions. So as those trickle in, I am going to move to our next slide. Just a brief introduction about who we are. So I myself am Carolyn Davidson. I'm the Vice President of State Engagement for Atlas. And in particular, I lead our work on the ground in New Jersey and North Carolina, who's not on this roundtable, but just as a heads up, you are in North Carolina. And I'm joined today at two of my other colleagues will be speaking, Angid Buttar and Leah Kaufman, are both directors of state engagement. And also on the line with us are Patty Villasenor and Amelia Wilburn. And so if you have any tech issues or any questions that you don't want to ask to the group as a whole, please feel free to reach out to Amelia directly. You can message her privately in the chat and she will help to steward those. Oh, and I realize that I'm still sharing the polling results. I apologize deeply. Don't need those up. Just as a quick agenda, we'll start by a brief overview of Shatterproof, and then we'll talk about why Atlas came to be in addition to what the platform is. We'll then talk about implementation, so what the timeline is going to look like, what that means for you all as providers in the states where Atlas is being implemented, or as stakeholders who aren't providers, what data sources are used for Atlas, and the project timeline, and then finally we'll end with how to get involved. And I'll note that there are reference slides included at the end of the deck, and this presentation is being recorded. We'll send out the recording and slides afterwards. But you are also welcome to take screenshots if there's anything you see that you really want to capture. So I'll start with Shatterproof's impact. So Shatterproof is a national nonprofit organization focused on ending the devastation that addiction causes, really focused on ending the addiction crisis in the US. We were founded by Gary Mendel, who's a former hotel CEO who lost his son to addiction. And it was only after Gary lost his son to addiction that he realized that there was evidence-based information about addiction treatment, and about the reality that it is a disease and should not be stigmatized, that he just didn't have access to as a father and as a person. And so he founded Shatterproof with the goal of bringing that evidence-based information to people more widely, and also really moving forward the addiction field. So Shatterproof really executes that work in three main pillars, which are revolutionizing the treatment system, breaking down addiction-related stigmas, and supporting and empowering communities. And within each of those pillars, we have at least one major project. So Atlas falls into revolutionizing the addiction treatment system. We have a national stigma initiative dedicated to breaking down addiction-related stigmas. And we have the Shatterproof Just 5 initiative, which is focused on supporting and empowering communities. And we also have an advocacy team and Shatterproof ambassadors that support across all pillars. So just for context in terms of how Atlas fits into Shatterproof's work. And so looking a little closer at the revolutionizing addiction treatment piece, our work in this area is focused on 5 main components: national standards of care, quality measurement, improving payment and coverage, educating medical professionals. And within those, Atlas touches these 3, so the national standards of care, quality measurement system, and addiction treatment needs assessment. And so really the kind of impetus for Atlas was the Shatterproof National Principles of Care. These are 8 principles of evidence-based addiction treatment. They're derived from the Surgeon General's 2016 report on addiction. So they're backed by decades of research. And these particular principles were taken from recommendations from that report and then condensed based on the recommendations of a group of subject matter experts. So clinicians, association heads, payers. And so in 2018, we launched these principles. We released them with the sign-on of 16 national health insurers who agreed to identify, promote, and reward care that aligns with the principles. But we knew that while a sign-on is very important, that there is more to be done to make sure that these principles are being put into action and aren't just sitting on a shelf. And so with that, it was very apparent to us, as it probably is to you all working in the addiction treatment field, how difficult it is to find addiction treatment. That even as somebody working in the addiction field, I struggle with this myself for loved ones and friends. There is a lot of misinformation out there. There's limited objective or unbiased information. It can be very unclear what to look for. And then even beyond kind of a lack of information, then there are also potentially harmful practices, predatory marketing practices, hijacking AdWords, and of course, patient brokering. And so as a response to sort of this gap in transparent, objective information about addiction treatment, Shatterproof created Atlas. And so what is Atlas? We keep saying that name. Atlas is a web-based platform that deploys validated measures to assess the quality of treatment facilities and then displays this information in a trustworthy, standardized way for people to use when seeking treatment. And that could be patients, family members, clinicians who want to refer a patient to a higher or lower level of care, payers, care coordinators. On the back end, Atlas also provides password-protected portals. So this is a more detailed view of the data, and this is for providers, states, and health insurers to really drive adoption of best practices. So the goal with Atlas is to set a standard for quality in the addiction treatment field, and then empower all these different stakeholders to make quality informed decisions, and really a rising tide lifts all boats approach, drive forward the quality of the field. And so what makes Atlas a bit different from other locators you may have seen, Atlas features a consumer-friendly needs assessment to help people understand what level of care may be most appropriate for them. It includes transparent indicators of treatment quality. It is not funded by providers. It is not pay to play. We include a comprehensive list of facilities. So we work with our state partners to determine who is in scope for Atlas. And all of those facilities that are in scope for Atlas are included on the platform, regardless of whether or not they submit data. So you don't need to pay in at all to be listed. Atlas also includes educational content on what to look for in treatment. And then, as I mentioned, those professional portals. And yes, you will be able to get a copy of the PowerPoint. Great question. And as Amelia noted in the chat, Atlas is mobile optimized. And so you can use Atlas you can visit Atlas on any device, be it a computer, phone, iPad, tablet, etc. And with that, I will turn it over to my colleague, Leah Kaufman, to show you exactly what we mean when we say Atlas.
Great, thank you, Carolyn. All right. So good to see everyone on. We're up to 193 attendees. I know we saw some of you in Florida just a week or so ago, so we're really happy to see you here learning more about the platform. So this is the Atlas homepage, and I want to point out two different items on the homepage. So Carolyn had mentioned the needs assessment, and that's this first piece here at the top. So if someone doesn't know where to go or where they might start looking for treatment, this is going to narrow down their options. I'm not going to get into it today, but just to say that we worked in conjunction with the American Society of Addiction Medicine and another organization to create this. It's 13 questions. It will not take the place of a full assessment once someone gets to a facility, but it does give them a starting point. And the other nice benefit of this is that if you do the assessment first, when you search for care using Atlas, it will narrow down your search results based on the level of care and additional services that were recommended to you. And we'll talk more about that as we look at the website. So just going back here to the homepage, someone can come and look for treatment by entering their city and state and their zip code. You can select a search radius from 3 to 200 miles. There is an option to select your insurance. I think many folks skip that field at this point, but it's nice to have there. And then we recently added, Carolyn, I think about a month ago, right, this option to search by facility name. So I know the first 6 states that have already implemented Atlas, we're really happy to have this. Makes it a lot easier when it comes to, you as the provider or treatment facility sharing with your patients this platform in which they can give feedback on their experience at your facility. So there's that piece. So we would click search and it will take you to a search results page. And on this, you have the ability to filter search results based on other factors that are important to you. So looking over here on the left-hand side, maybe I know I'm looking for a facility that focuses on opioids. You can select payment options. So maybe you are a cash patient or you have Medicaid. There are treatment types. So if I know that I'm looking for an outpatient facility, I can select that. And then a number of other items that you can filter by, which you'll see as we get into the facility profiles. But medications for opioid use disorder, that's often something that we hear feedback that folks are looking for. Languages spoken, really important. I know there's a lot of other languages besides English spoken. So we have, you can see whether staff in a facility speak those languages. And then being able to filter by patient populations. We also have a Google Maps integration. So everyone's at this, in 2021, many folks are familiar with that, and it's integrated into so many other sites. So you can select a facility directly from the map if you wanted to, or you can pick from the search results here. So I had already selected one of these. When we click on, there we go. So when you click on a facility, you arrive at their treatment facility profile. Now this, we'll talk about the Atlas survey process that you all will be participating in this fall. But that information that we gather directly from treatment facilities via that electronic survey is the primary source that we use to populate these profiles. So our goal is to get a majority of facilities in all of the states that will be doing survey collection this fall, so that we have really rich profiles with all this information for folks to use when they're making care decisions. So right here at the top, you'll see that we include websites. So that's great. People can click through and learn more information about you. You'll have an opportunity to provide your mission statement and talk about the areas that you might have expertise in. We of course include contact information in Atlas. We do quite a bit of work to verify this. And I know there's a lot of consolidation or changes happening in the treatment space. And we want to make sure that we have the best way for folks to reach out to you. The top portion here, so we've had some questions. I know those of you in Florida had an opportunity to take a look at this a few weeks ago. And one of the questions that we had was the frequency of updates. So we'll be doing this survey starting in mid-October. You'll be able to give us this initial information. And then once the website is live in all of the various states next spring, there is a password protected portal, and I won't talk too much because I know we're touching on this later, but you'll be able to update this top section here. You can submit updates to that via that password protected portal. So you see up in the right-hand corner, this professionals button. All facilities that provide information to or do that survey this fall will be able to have access to that. So you'll have your data, it's displayed a little bit differently. You'll have a little more information than the public has, but can also submit the updates that way. And then right here, it will show you the date that information was last updated. So that's really useful for the public to know how current the information is. Just to point a few things out here in this top section. So this facility has multiple locations. You'll see there's a hyperlink here. I can click that. I can see what other locations Odyssey House has in Louisiana. We include information on accreditations. And then I think we talked about most of these. The special groups I like to point out, because this is something that we've done user testing and consumer focus groups. This is really hard information to find. So having this information in Atlas has been hugely beneficial to a lot of people. For example, finding a facility that accepts pregnant patients. And then of course, the information on LGBTQ welcoming facilities. You see the languages spoken and insurance information and hours. The second section of the treatment facility profile is what we call the quality data section. So Carolyn talked about our national principles of care, and this correlates to principles 2 through 8. So the first principle that she touched on, it's looking at conducting screenings for STD in a general healthcare setting. So that's not included, but you see principles 2 through 8. So looking at things like same-day access to care, does the facility have a policy that makes that available? Are they doing standardized assessments? You can expand each section if you want to see more information. We tried to kind of walk the line between not overwhelming folks and trying to be responsive to the feedback we heard, where some people do want a lot of information. So there is the ability to drill down. These little icons are located throughout Atlas. So this provides, again, more context, more information nested throughout the profiles. If you don't know, what something is, you can click on these. And I believe, so we initially launched this, I believe we had everything written at a 10th grade level. And Carolyn, please correct me if I'm wrong here, but I think that we've tried to, we're working on getting this down to a 6th grade level, right? Yeah, okay. So there's that. We won't go through all of these, but you know, just to see, we have information on you know, whether staff are licensed or certified, whether they have whether you have mental health or physical health care available. This looks at ongoing follow-up and modifications to treatment. And then this last section here, you know, again, really hard to find. So I think that this has been useful not only to the public, but to referral sources. So, you know, in the first 6 states that we've worked with, once the website was live, we began working with individuals in the state to ensure that the public knows about it. So, you know, you can build something, but if people aren't getting to it, you know, it's no good. So feedback we've had on this so far is that this section here with social services, information on whether facilities have peer recovery support services, transportation to and from treatment. You know, when hospitals are referring, or when primary care providers or others are referring, this is just a level of detail that's been previously very difficult to get. So, and on that piece, I'd like to say too that we're always looking for feedback, working with the provider community to add to Atlas, to help clarify things, and to just keep making it the best resource that it can be. So I think I speak for all of our engagement directors when I say that we'd love to hear from you throughout this process. You know, how else can we add value? And last but not least, so this section at the bottom is the patient experience feedback section. So in addition to asking facilities to do that survey starting mid-October, we'll be working with you to collect patient feedback. That's also an electronic survey. We'll get into more detail on what that looks like, but just to show you here, so you can see for this facility, 132 surveys have been completed. And then for the state overall, we'll show the total number of surveys completed in the state. And you'll be able to look at each of those questions. Again, we've nested information here, so you can expand that if you want to. But for this particular question, how much have you been helped by the treatment you got here? 51% of people at this facility felt they were helped a lot, versus the state average of 77%. So, you know, we don't have a composite score or a star rating system with this. It's really just trying to help people understand, you know, who's offering which services, how are you performing in relation to your peers in the space? For more context, on the right-hand side, we have some free text feedback. And then some of these are more helpful than others. A lot of them are shorter comments, but I think this is something that as we've worked with facilities and provider associations, that this has been a big added value for facilities in terms of looking at where they can target quality improvement efforts, you know, what you're doing well, where there are opportunities. And final note on this piece, so this will only become public once you have at least 20 responses for your facility. I know something that we heard on the last, on our Florida event was a question about, you know, if I'm a smaller facility, it might be hard to get those 20 surveys in. So one thing we're launching this fall is a patient experience toolkit. And we've essentially taken feedback from some facilities in New York, West Virginia, some of the other states that have done this, and kind of packaged their tips and tricks for getting that feedback. I know it's been particularly challenging in a COVID environment to do that, but there are some folks who are doing that really well, and we look forward to sharing that with you in a couple months. So I think just one more item to show you the compare feature. Oh, actually, so a facility, so Carolyn mentioned that all facilities in the state are included in this, but we'll automatically filter by facilities that completed the Atlas survey. I did want to show you what it looks like when a facility does not complete the survey. So you can see we still have, of course, the name, the contact information, but people just aren't going to be able to see all of that helpful information. It'll just say data not available. The nice thing is that you'll still have potentially patient feedback. So patients would be able to leave feedback even if a facility hadn't completed the survey. But just, we really encourage you to do that and to make that information available. And then finally, the compare feature. I think this is probably one of the favorite things for both consumers and providers. But just looking at facilities side by side, you can compare and see which facility best meets your needs. I think this is really helpful in the quality data section. Just knowing if I want to get in same day, that this facility is not a good option for me. Maybe I'm looking for MAT or not. You can see that information. And then, facilities that have primary care mental health services. And at the bottom, so you can see what it looks like when a facility has no patient feedback there. And I think that covers everything I wanted to get through. Carolyn, Angad, are there anything I missed that you wanted to add?
I'll just make a small note, Leah. I think you covered all the key things, and we saw a few questions come in the chat about if you are able to filter by facilities that take, for instance, Medicaid, or for instance, sliding fee scale. And yes, you can indeed, as you'll see on the left side there, you can filter by a number of different options. So Atlas includes facilities regardless of the insurance that facilities accept, and regardless of whether facilities are private, are for-profit or not-for-profit. And we're also adding the ability to filter by TRICARE. I know that was something that Angad and I discussed just yesterday, I think. So TRICARE military insurance, as well as IHS, so Indian Health Services.
Oh, wonderful points. Yeah. Great. Well, I will stop sharing that. To turn it over to Angad. Oh, actually, no, this is my slide. One more slide, and then I'll turn it over to Angad. So in terms of website updates, so Carolyn just mentioned one exciting update in terms of payments. We've been working the last few, probably the last year since the platform launched on some of these, but very excited to share that we'll soon have the website fully translated or available in Spanish. And that goes for, Carolyn, correct me if I'm wrong here, but I believe the patient experience survey as well. Yeah. Okay, great. And we are looking, I know there's been questions about other languages. That's something we're looking at the capacity to do in the future, but for now it would be English and Spanish. So integration of state resources, we have done this so far in 6 states. Really excited to continue to expand to New Jersey and to Florida and Oklahoma and Pennsylvania. As we do that, we're looking at how we can work with states to minimize provider burden. This is something that always comes up. We're very cognizant of the fact that you all report to many people on many things. And just to know that we're looking at how we can possibly, pull data in from other sources in the future, so you're not repeating the same information being shared to different entities. Updated educational content to increase accessibility. So I think I touched on this briefly, but just making sure that it's at a reading level, taking into account varying degrees of health literacy. And then improving the professional portals. We didn't look at those today, but those who participated in the first round had a professional portal or that password protected portal to log into that was a little bit more static. So we did provide some benchmarking information and the ability to download a report and take a look at how you're performing across those various categories in relation to your peers. We recently integrated Power BI, so we have much more interactive dashboards. I know that's something we're looking forward to sharing with you. So you'll benefit from that once the platform is live. You'll have those logins. And I think now I will turn it over to Angad. Angad.
Sure. Thank you, Leah and Carolyn, and thank you again for everyone for being here today. So as we talk about where we are going with Atlas, we thought it'd be helpful to provide some context in terms of where we started. So we started with $5 million in funding from philanthropic sources and started in 6 states that you can see highlighted here. So New York, Massachusetts, Delaware, West Virginia, North Carolina, and Louisiana. TreatmentAtlas.org was launched back in July of last year in our 6 initial states. Last year, we also launched our continuous quality improvement learning series. And this was our opportunity to work with our states and providers to provide technical assistance via webinars. And so we conducted, I believe, 4 webinars from September through December last year. We held 1 session already so far this year, and additional sessions will be coming forth later on in 2021. So as we, get the next slide, please. As we continue our work, obviously, the 4 states represented here today, Pennsylvania, New Jersey, Florida, and Oklahoma. We've also recently launched, we'll be launching in California as well. And there's additional states on the horizon. So we're really excited about the growth that we've seen here in 2021 and the growth that we will be seeing in 2022 as well. Next slide, please. So as we talk about our Atlas funders, and it might be a little difficult to see on the slide, but there's 3 categories of funders that we've had to date. So first, payers. So you can see large commercial payers across the top third of the slide. In the middle portion of the slide, you can see state agencies. So we've been, great based on the work that we've done with our state partners, have received funding in a majority of our state agencies. And we've also received philanthropic funding as well via various foundations that help either in specific states or across the majority of our states. And so Atlas has 2 main data sources, and we talked a little bit about the patient experience survey, and some of you probably have already heard about the treatment facility survey. So the treatment facility survey is going to be how Atlas sort of ingests the information based on your treatment facility. So it's an online survey that really understands the services that are provided at your facility. It looks at the processes, structures, and services. And so as Leah walked you through Atlas, you were able to see the facility profile and all the information that's listed there as it relates to the services that are provided will be coming from the survey. And that survey process will start in October and it will run through January. And we'll talk a lot more about that over the coming days and weeks, believe me. We also have our patient experience survey, as Leah showed you in Atlas. And so the questions for our patient experience survey are based on the CAP, ECHO surveys that have existed in healthcare and have been sort of validated at really obtaining healthcare quality outcomes. And so you saw the questions and sort of how they, how facilities look at, the benchmarking for other facilities in the state. There's the open-ended question as well. And I did see a question come through in the chat in terms of, how are these, these responses validated? So there's a couple of things here. First, we use something called natural language processing. So we really want to make sure that all the responses we receive don't have any inappropriate language, don't call out individuals by names. And so there's an automated process that is used sort of behind the scenes to check for that. There's also a human review of those responses that occurs as well. We also make sure that that based on someone's sort of IP address, that multiple responses weren't left for a facility at a given point in time. So we have sort of algorithms that run behind the scenes to check for that as well. Responses stay on Atlas for about 18 months as well, and providers can also flag responses on their survey, patient experience responses in their portals as well. And once that's flagged, we'll take a look at it to understand if there's an issue or if responses sort of violate our Atlas terms of service. Next slide, please. So in terms of forthcoming data sources, we have claims measures. And so the planning for that is underway as we speak. And the goal here is sort of twofold, right? First, to improve and streamline the processes for calculating claims-based measures and to support the use of these data in 2022 and beyond. And secondly, to improve the public display of claims measures on Atlas so we can support the consumer use of these data to inform treatment decisions. So the process will end at the end of the year in December, and it will include a couple of things. So first, focus groups and testing to make sure that the claims measures are displayed in a sort of format that's easy to digest. We'll also have 4 stakeholder convenings to discuss claims measures calculations and develop development of a claims roadmap, including, oh, sorry, my chat's popping up, I apologize. Sorry, so the development of a claims roadmap, including recommendations on the professional portal and measuring reporting and considerations for implementing the recommendations in 2022 and beyond. So as I mentioned, Atlas was launched just 13 months ago in July of 2020 in our 6 additional initial states. And to date, we have had over 125,000 visits to Atlas since it's launched. We've had individuals have conducted more than 12,000 searches on Atlas as part of their decision-making process when looking for high-quality treatment for either themselves, family members, or loved ones. And facilities have been viewed more than 11,000 times in Atlas. So what to expect over the coming months? So that's a question I know I've gotten from some folks in Pennsylvania, and as I'm sure Leah's gotten as well. So we're, from where we are, where we were in May to where we're going in the spring, we've done a lot of planning in our states, working with our state partners, various stakeholders. In some cases, we may have had a project kickoff, like a formal project kickoff. Over the summer, and sort of where we are, right now, is stakeholder engagement, right? So understanding, who are providers, establishing state advisory committees, working with community organizations, provider associations, conducting, Atlas webinars, answering some questions that folks might have. So it's a lot of the work that we've been doing, sort of, over the summer months. Quickly, we will sort of pivot to, in October, our Atlas survey collection. Again, this is what I mentioned just a few slides ago. This will be the opportunity for treatment facilities to provide information that will then populate in Atlas. And the information that's provided in the surveys goes through some validation as well. I did want to mention that. We get questions from folks where people get concerned if they're self-reporting, they want to make sure that there are sort of validation steps that are taken there. So that will occur soon after the survey closes. And then from February to March, we'll conduct that data analysis, the validation. We also have a provider preview period. So this will be providers' opportunity to review the information that they sent to make sure all is accurate. There were no sort of data transfer issues, so they can have one final check there. And then in the spring of 2022, the Atlas launch Atlas site will launch for Florida, New Jersey, Oklahoma, and Pennsylvania. So in terms of looking at your role as a treatment provider, there's a couple of things here, right? So as a participant, we hope that you submit the Atlas survey for your facility or facilities when it opens in October of this year. We will be reaching out to you several different times with your survey link. As we mentioned, it's an online link. We'll have resources to help assist any questions that you might have. We'll have a help desk set up as well. And then encourage your patients to fill out the Atlas Patient Experience Survey. Obviously, very valuable for patients that are seeking care to really understand how other folks, what their experience was, at a specific facility as well. You'll also have the opportunity to attend our provider roundtables, such as the one we're having here today. I know I saw a question earlier, if I miss one, are they all the same? It's the same content. And the answer is that each roundtable will have new content, a new agenda, and we'll continue to sort of answer new questions that we'll be having there as well. You can get feedback during the comment opportunities, as Leah mentioned earlier. We really thrive on getting feedback on things that we can improve upon, whether it's workflow related or sort of the user experience. Now, we can't guarantee that we can sort of address and implement every single suggestion, but it's good for us to have as we continue sort of to look at improving the process. We also want to make sure that you tell your colleagues about Atlas. We're doing the best that we can to sort of help spread the word, but to folks that are sort of on the ground in the respective states that are represented here today, it's certainly helpful if you all can sort of spread the word amongst your colleagues, that you might have there in the state as well. And last but certainly not least, attending our Atlas Continuous Quality Improvement Learning Series. Again, I mentioned that a few slides ago, but those are webinars that we host where we provide subject matter experts come to present to our states and providers, really in the spirit of technical assistance. Next slide, please. So why participate? Well, before I get sort of too far down this road, we received sort of a really heartfelt story from an individual who was in recovery, unfortunately had a relapse in one of our initial states in Delaware. And when they were looking for recovery, or treatment the first time, they used sort of the conventional resources, several years ago. Unfortunately, when they had to look for treatment again, they were informed about Atlas. And we actually received feedback from the individual and their network about how easy it was for them not only to look for treatment, but they were actually surprised about the number of facilities that were providing high quality treatment near them. And so, that's one story in one state. And I'm sure there are countless stories in our other states as well. So when you think about, why participating, it's filling out a survey. It's a little bit of extra work on the front end of it. No doubt about that, no question. But just remember, there are folks that will be looking for treatment and that will no doubt benefit from the information that you'll be entering in to our platform. So in terms of getting a little bit more information about why to participate, submitting into Atlas, you'll have the opportunity to market yourself. Organizations will be listed, as you saw during Leah's walkthrough. The facility, there's no cost to participate, and you have the ability to access technical assistance and to network with other providers as well. Atlas is also, it's a chance to help patients find other levels of care that meet their needs and give feedback on their treatment experiences as well. And participating in Atlas is a chance to have a voice in moving forward the quality of addiction treatment. So stakeholders are our number one priority, right? Along with those that are seeking treatment. Provider roundtables are virtual events for providers and other stakeholders to hear about not only project updates, but ask questions based on experiences that they might have, or and I've seen a lot of them sort of in the chat already. And a lot of these questions might be sort of state specific, but a lot of them will sort of be across various states as well. We also have our Atlas State Advisory Committees. So this is sort of a group of interdisciplinary folks across the treatment landscape in our state. So whether partnered with our state partners, providers, community organizations as well. And it's really their opportunity to sort of advise us on the implementation of Atlas in their state. Each state's going to have their own sort of unique layout, and so we want to be sort of respectful of that and make sure that we get sort of the perspective of those important constituencies. And then also conference attendance. We frequently attend or present at state and national conferences, both in person, hopefully, when that opens up again, and virtually. And so we look forward to seeing you there, again, either in a virtual environment or in person as well. So a lot of folks sometimes ask, how can I get involved in Atlas if I'm not a provider? So here, I won't go through every single bullet point, but if you're sort of a stakeholder in a provider association, community advocate, or even law enforcement, you can join our Atlas mailing list. You'll receive updates on webinars, on sort of blog posts that we produce, and so it's a good way to sort of just hear the pulse on Atlas and future updates. Please tell your network about Atlas. To the extent that we can, we will be sending out information. But sometimes, as we are new to your state, it's helpful if sometimes folks hear it from a familiar voice and from a familiar source as well. And then encouraging your network to participate in the Atlas survey, certainly very helpful. We're hoping for, obviously 100% participation in our states, but understanding that may not be reality, but we want to sort of endeavor to get as high participation rate as possible. And then if you're an individual or a family member who's been impacted by addiction, please give feedback during common opportunities. I know we've conducted some of that feedback in some of our other states, and just hearing someone's experience utilizing maybe another resource and the issues that they saw, the barriers that they saw during a very trying time, and then their experience using Atlas, it was just helpful, if nothing else, to know that, from a user experience perspective, it was a bit more streamlined and a bit more sort of easy for them to navigate searching for treatment. Exploring the Atlas website and giving feedback for improvement, encouraging friends and loved ones to leave feedback at treatment facilities where they've received treatment. Again, very helpful and important. And then last but not least, using Atlas when it launches in New Jersey and all of our states in the spring. Again, we want to help sort of promote to the best that we can when Atlas goes live. So provider roundtables, Shatterproof hosts provider roundtables that are monthly webinars. And the purpose here is to really sort of not only socialize a project and provide updates to providers, but also to sort of make sure that we are being available to this community of providers, state leaders as well, to help answer questions. Also, each webinar will end, as we will here in a few minutes, with a question and answer session. And then we will have recordings of the events that will be provided to everyone. So folks who were not able to attend, they'll have access to this. And then we will send them the slides as well. And then you also have the dates and the links to register for the future webinar. So please do so. So I will close it off here. So please check out treatmentatlas.org to learn more about Atlas and explore the platform. If you have questions, again, please don't hesitate to ask. During the Atlas survey collection, I mentioned there'll be a designated help desk. So it's a resource that we're excited about because we know it's going to provide a ton of value. And for other questions, don't hesitate to reach out to your state engagement director. I'm working with Delaware, Massachusetts, Pennsylvania, West Virginia. My colleague Leah is in Florida, Louisiana, New York, and Oklahoma. And Carolyn is working with North Carolina and New Jersey. So I think we have our exit poll that should be coming up here shortly. So please, if you're able to leave some feedback there, then I'll turn it back over to Carolyn for our Q&A.
Sure, and no, you're good. Apologies, I paused the exit poll. So we will put it up at the very end once we get a chance to do questions, because I realized that there were probably a lot of questions that came through. And so many of them that were covered in the exit poll may be answered. I know that we had a number of questions about how to enroll in Atlas or participate. And so as a note, the Atlas includes all addiction treatment and withdrawal management or detox providers that are licensed or certified in each of our states, depending on your state's system. And so what I mean by that is that if you are licensed or certified by your state's health department or department of licensing, you will automatically be included in Atlas. So for instance, if you got an email from your state asking you to join this webinar, you are likely already included. So you don't need to do anything extra to be added to Atlas. But as Angad and Leah pointed out, you can have your information updated. Sorry, my cat's beside me distracting me. You can have your information updated on the website so that your profile is complete by filling out the Atlas survey. And again, that will open in October. If you are, for any reason, unsure if you're included in Atlas, you can email either your state director, or we have the general Atlas email, atlas@shatterproof.org. I know we had a similar question about our non-treatment services included in Atlas, such as harm reduction providers, peer recovery services. This is a great question. Right now, Atlas focuses solely on treatment and withdrawal management or detox providers. And so if a facility does not provide treatment or withdrawal management, it won't be captured in the website. But we know that there is much more to recovery than just treatment. And so in many of our states, we're working on incorporating a button so that when you search for treatment, say in Massachusetts, you'll be shown the option to contact the state helpline or in some of our states, the local county authority, so that you can access more resources than just treatment. We know that that's a big point. And we also know, for instance, that there are a lot of social needs that come along with needing treatment. So for instance, you can learn more about housing or about employment. Let me pull up, Leah Angad, please feel free to jump in if there is something I missed. Otherwise, I will pull up our questions and go through those. And so I know that we also had a question about the provider search. Just to note that the provider search, when you search by a treatment facility name, if there are multiple facilities with that name, all of those facilities will come up. So for instance, Eleanor Health is a facility that is an organization that has facilities across many of our states, as is Gaudenzia, Pyramid Healthcare as well. And if you type in one of those names and search, you will see all of the facilities regardless of the state. Questions? Sorry, let me see if there's something else. And I know that I saw also several questions about how Atlas is marketed once it goes live. So this is a great point, and it's something that Leah and Angad and I focus a lot of our time on when we are not focusing on data collection. So when we work to disseminate kind of information about Atlas, it's done both through kind of the stakeholders that we work with to implement the data collection process and implement the website generally. So that includes our treatment provider associations, local advocates, drug courts, law enforcement, but also we work on the ground with different communities and individuals who work with those who may not have access, for instance, to a website. So we provide direct trainings for many who may need to seek for treatment, may need to help locate treatment for a lot of people. So we're happy to provide trainings for care coordinators or justice-related organizations, for case managers in hospitals so that people know where to go to help others find treatment.
Carolyn, there's a question. What about individuals who, just disappeared. What about individuals who receive state or not able to pay for treatment? Will you be able to see if state or county funding is taken by a program?
Great question. We don't currently have a filter to see if state or county funding specifically is taken. We do offer filters for, as you saw, Medicaid, cash or self-pay, sliding fee scale, and we're also working to add filters for a few other payment options, so public, state funded or federal funded payment options. And then we also include a filter if no payment is accepted. So if a facility is already fully funded, for instance, by the state or county, and they don't accept payment from patients.
Great. Next question. I went on the site and put in my zip code, and the closest facilities that this person found were 45 minutes away from their facility. Or I'm sorry, 45 minutes away. So not so much a question.
Just a comment. In general, no, great question. So as Leah noted during her demo, we automatically filter by facilities that have provided data to Atlas by filling out the Atlas survey. And so in some areas, this may mean that if a facility has not provided data, or if a large number of facilities for whatever reason have not provided data, then those would not pop up. And the reason for this is that we just don't really have quality information about those facilities. We don't have any way, we don't have data on what services those facilities are offering, if they're following best practices. And so they don't pop up immediately, but you are able to deselect that quality data provided filter to see them. And I know we got a follow-up question in the chat that if they were licensed by the state, you are included. Yes, so as Leah clarified in her demo, all facilities that are licensed or certified are included, but if you do not submit data, you will automatically be filtered out of the search results. There is a filter that you can deselect that says quality data provided. As you saw before, Leah showed a facility profile that said data not available. So an example of what you would see if a facility did not submit data to Atlas. And so Leah is pulling this up right now. And so you can see here that there's a number of facilities, and there is that quality data provided filter. So all that is to say, you don't need to do anything to have your facility listed in Atlas, but if you would like quality information provided, you need to submit that Atlas survey. And Leah, did you have another item to add there?
No, that answers that one. There was another question, Carolyn, about whether we have an open beds feature built into Atlas.
Great question. So Atlas does not at this time have an open beds feature. And just for a bit of context, when we were creating the platform, we kind of thought about, do we want to focus more on availability or on quality? And so with Atlas, really our aim was to focus on that quality piece rather than necessarily helping somebody get a bed at a center that may not be of high quality. We are adding the option for patients to be able to contact a facility directly if they are interested in receiving treatment from a facility. We also include information on if a facility, if they are outpatient, if they accept same day or walk-in appointments, and for those facilities that are not outpatient, so inpatient and residential, what their practices are if they don't have any open slots or open beds.
Great. There's a question, I'm going back here. It looks like how do you get the word out about Atlas to those in need? Great question.
Great question. Yeah, so as I mentioned, we do a number of different trainings. We also do large advertising. So on the internet through both paid and social media, we advertise on Spotify, Facebook, Google, kind of the usual suspects. As we noted before, we speak regularly at conferences and local events. Certainly, we're always happy to come to a local event, whether it's virtually or in person, to give a presentation. We do local trainings and more. And Angad, I'll turn it to you.
Yeah, no, thanks, Carolyn. I will say this is, I think, a great way for you all to partner with us and help us understand, in addition to all the great things that Carolyn just mentioned, but other sources that might be sort of specific to a state or a jurisdiction that work with those that are seeking treatment. And so I think where we've had our most success in states is when we've had that sort of connection with our providers and other community organizations, whether it's helplines or other referral sources as well. So please don't ever hesitate to let us know of individuals that we can network with as well.
And thank you so much for adding that, Angad. I know I appreciate that note. I know that we are right now, I'll just add one final note before I close out. I'll note that the facilities for New Jersey, Pennsylvania, and Florida, as well as Oklahoma, who is also in this timeline, will not be visible on the Atlas website until spring of next year. So if you go on Atlas right now and you say my facility isn't listed, it's not going to go live until until everybody has submitted those data, we've analyzed them, and we've given you the chance to preview the data. So you won't be able to find anything, for instance, in Florida or Pennsylvania or New Jersey at the moment, unless you are very close to another state where Atlas is currently implemented. I noticed that we're at 2:58, so to be respectful of people's time, we are going to end the formal roundtable, and I'll have Amelia, if you could put up that exit poll. I know there were several questions that were not answered, and so we'll certainly be following up afterwards. And please fill out the exit poll when you get the chance. We really want to know what you'd like to see covered at future roundtables so that we can make these events really useful for you. And also, if you have a few moments to stick around, we'll answer a few more questions. But again, this is all being recorded, so if you have to hop, not a problem. You will see the recording and slides sent out probably in the next day. We have to edit and then post it on YouTube. But for now, thank you so much. I know Leah and Angad and I are truly grateful, as well as Patty and Amelia, that you made the time to attend today. And while that exit poll is being completed, I see that we have a few additional questions in the chat that I want to see if we can get to. I know we had a question asking if Atlas is going to use data that is already collected by state agencies. This is a great point. So we know that in many states, there's already a rigorous licensing or certification process in place. Currently, we are not integrated with those state licensing or certification processes, But that is something that we're actively exploring with our state partners. We really want to make sure that Atlas is not a burden to providers, but is instead really a benefit to you all. And so we're exploring what that would look like, how we would get those data, how frequently they would be exchanged. But for now, we are using the treatment facility survey. And as Angad noted, that takes a bit of time on the front end, about maybe an hour to an hour and a half. You have 3 months to submit it, so you have a long time to do that hour and a half. And as Angad said, we have a help desk that is available during that time. But we're looking to really reduce that burden moving forward. And I know that we also had a question if Atlas is legit script approved. Yes, Atlas is legit script approved. So I believe if you scroll down, if I'm not making this up, I believe that if you scroll down to the bottom of treatmentatlas.org, yes, you can see there that there is the legit script approval. I also know we had a question. One of the principles of care that we covered is coordinated care for primary or behavioral health care. And as some have pointed out, it can be difficult for small treatment organizations that aren't necessarily part of, say, a large hospital to offer that coordinated care. We very much recognize that. We know that patients, really our goal with Atlas is to help patients find the most appropriate treatment. So we know that patients for whom that is a priority will be able to filter by that. But for those who are not, it won't dock kind of the overall view of your facility, I'll say. And also I'll note that with the changes that COVID has brought about, we do consider telehealth to be coordinated care. So if your facility offers primary care via telemedicine, that would count for the Atlas purposes as offering primary care. And Leah, I'll get it there. I'm going to look at my list of questions, but if there are others that you all saw come in that I didn't answer, please feel free to jump in.
I think Amelia might have some. Amelia, do we have a few?
Yeah, there was one that really stood out to me, Carolyn. Somebody was asking about how reviews are proven to be legitimate and not spam.
Great question. So I know that Angad touched on this, and I'll reiterate. So when a patient submits a review, when a patient or loved one submits a review to Atlas, we ask that they accept the Atlas terms of service, which asks that they are not spamming. But of course, as we know, that's only the first step. So as Angad mentioned, we also on the back end have an algorithm to track whether reviews are coming from the same computer, for instance, in a very short amount of time with very similar responses. So if we all of a sudden see, say, 7 negative reviews come in from the same computer, even if they're negative reviews for different websites, that will be flagged on our end, and we will investigate those reviews further. Also, a member of our team reads every single review. And so any reviews that violate the Atlas terms of service, whether that's racism, outright sexism, homophobia, mention of illegal activity, will be removed, as will any reviews where it is obvious that the patient is not speaking for themselves. So we really take great importance in making sure that the patient or the loved one is the one filling out the review. So for instance, you can't have, say, a nurse practitioner fill out the review for the patient. That would be flagged as well. Trying to think if there are other questions. Oh, I know we had a question. Thank you to who brought this up about language options for those who are deaf or hard of hearing or in need of American Sign Language. And so that is information we collect, and you are able to filter by that. I'll note that with Atlas, as you've possibly seen on the website, the options that pop up in those filters are based on what is in the radius that you are searching. So if you're searching a really small radius, you might see really few language options, for instance. You can try broadening the radius to see more language options pop up. And I know we've got a question about technical assistance. Angad, would you take this one?
Yeah, sure. So Becky asks, what technical assistance support and resources do you offer to providers as it related to website or actual treatment? So actual treatment. So the sessions I mentioned that we had late last year from September through December were all about quality improvement and providing treatment for providers. And so in the interest of time, I would mention we have those webinars on our site. So if you go to treatmentatlas.org/CQI, so continuous quality improvement, CQI, you can see those sessions. You can see a little bit more context and background on our CQI learning series. But good question. Thank you.
I just added that link to the chat if you want to see. And as Angad mentioned, all of those sessions are provided for free to providers. And those really give you an understanding of how you can leverage the Atlas measures and just generally make quality improvements in your facility. And trying to see if we have any other questions that I may have missed. Amelia, Angad, Leah, again, please feel free. Apologies. Trying to multitask like 3 separate windows.
Yeah, somebody asked, does Atlas give the opportunity for providers to individualize their facility? Like, how would they tailor it to show exactly what they do versus other people?
Great question. I think I remember seeing that question come in about the facility description. And so you are very much able to personalize that facility description and kind of mission piece. And that is really the time when you can talk about what the specifics that your facility brings to the table are that makes it unique from other facilities. So for instance, if you are a faith-based facility that does abstinence-only treatment to women in need, that can be a point that you highlight in that description piece. Otherwise, the rest of the profile is relatively consistent so that people can compare between facilities.
And there's, of course, the link to individual websites. So people who want more information can go there.
And I know we got a lot of questions about how states are currently using Atlas, states or other stakeholders. And I also see that that was the most popular option for discussion at the next event. So that will certainly be on our agenda in just over 2 weeks. In mid-September at our next roundtable. Great point. And similarly, I know that we had a question about quality measures. We can certainly send out a bit more information on those and really the process that was used to develop those quality measures. And otherwise, I know that we are nearing 3:10. Are there any last minute questions? Or I said this to my team members yesterday, burning desires, if you're in like 12 step, get out your burning desires.
It looks like we may have gotten through everything, but we'll definitely go back to the questions. We really appreciate how active and involved this group has been. If you didn't get an answer to your question, we'll make sure to follow up with you via email. If you think of anything else, as Carolyn and Angad shared, we're all here available. Please feel free to shoot us an email.
Thank you all so much, and we'll talk to you soon.
Thank you, everyone. Have a good rest of your day.